this is Dr. Michael Ryan with Missouri Vein Care. I wanted to talk a little bit about what are the treatments for a vein condition. When you have a diagnosis of vein reflux, as we call it, there are treatments that can really help. The symptoms go away, energy comes back up because low energy and fatigue are probably the most common symptoms. So the common treatments are designed to actually close down the abnormal veins. When the veins close down, there is excess veins already in your legs that the blood reroutes to automatically, and that's how the circulation speeds up and improves. So probably one of the most common treatments we perform is called a ablation or closure procedure, and we use a method that involves a technology called radiofrequency or laser ablation, and they're very similar in how they work and how the treatments are performed. We first make sure you're comfortable with numbing solution. After that, we put an IV in, and then a tiny catheter goes in the IV, and this catheter has the working end of the system that heat seals the vein on the inside. There's no surgery, there's no incision. It takes about 15 minutes to perform, and after treatment, people are able to get up and walk out the door and go about their activities right away. That's been a major advance and really a true revolution in vein treatments because it's very safe. Because you can move and walk, that keeps the blood flowing and keeps blood clots away. It makes it very safe. So another type of treatment we do is called sclerotherapy. Sclerotherapy is very commonly performed. The goal, similar to the ablation, is to close the vein down, the abnormal veins. And these are ones that may be under the surface or ones that you can see on the surface. We make sure you're comfortable as well with numbing spray for that. We find the vein either with an ultrasound machine or a special light, and then we do an injection with a chemical solution. The chemical solution will irritate the inside of the vein and it closes off. When that vein closes off, you can expect that it will be tender and sore and even have a red spot or even a red streak as the body heals and closes down that vein. After a few weeks, the tenderness and the red streak and lump will begin to fade away as you heal. And that circulation will then reroute to other veins that are working normally, and that's how the circulation will speed up. Final treatment that we perform involves what we call phlebectomy. It's a limited vein removal for those that have very visible bulging veins. Sometimes that's really the best way to treat it, and it's actually associated with the quickest and most comfortable recovery because you're actually removing the vein that's causing all the symptoms and it's gone. And for people that are concerned about the appearance of veins, that's also usually the very best way to get the legs looking normal again. People want to have their legs looking normal. So when they have bulging veins, we numb the skin up, and then we make a series of micro incisions with a tiny needle, and then we remove the veins. Usually at 1 month, it's difficult to tell that you've had a treatment, and it's difficult to tell that you've had a vein there. So people are very excited about that, and because their legs look normal. Everyone wants to have their legs looking normal again. These procedures are very safe. They're commonly performed, and the reason why they're so safe is because people can get up and move and walk, and that keeps blood clots away. There are some other side effects. For some people, they can expect swelling, tender lump, bruising, and for those having injection treatments, sometimes there's a reaction to the solution itself that can cause a skin sore. And whenever you're using any medication in the body, some people can have an allergic reaction, which we screen people for ahead of time. That's very rare, very uncommon. Other side effects for treatments is that some people can get some numbness or tingling. That's related to nerves that are in the areas of the veins we're treating getting irritated by the treatment, either the ablation or the sclerotherapy. It's difficult to predict where those nerves are, and so we can't really know ahead of time if that's going to happen. It's uncommon, but it can happen. Other side effects is as the visible veins close down on the skin, the body wants to reabsorb them and dissolve them. And most people are able to do that quite adequately, but some people, as the body is trying to resolve that vein and close it down and absorb it, there is a brown streak that's left behind. And that's something that's difficult to predict ahead of time. And for some people, it's a minority, that is something that can be left over. So this is Dr. Michael Ryan with Missouri Vein Care, and I hope this has been informative for you.